Welcome to A Healthier, Happier You, the people working to make it happen. I'm Evan J. Chalfin from Luxhammer, where we help the brands to help you live healthier. Today, I'm joined by Dr. Tina Saw, founder and CEO of Oral Genome, who's revolutionizing preventative healthcare through advanced saliva testing technology. Dr. Saw and her team are making sophisticated biomarker testing accessible to both consumers and dental professionals. Dr. Saw, thanks for being here.
Thanks, Evan, for having me on your podcast.
Glad to have you. So, as both a practicing dentist and entrepreneur, what inspired you to create Oral Genome?
Well, for me, it was to help my patients answer questions about their dental health, especially on the prevention side. I feel like dentistry, there's this frustration from patients in the chair where when a cavity already has occurred or they already have gum disease, they need this treatment. And I think a lot of people have really good intentions. And if they're able to prevent these diseases, they are going to. And so for me, it was to help my patients answer these questions and get to some sort of prevention before they had these problems occur.
So, your technology uses nanobead antibody conjugates to analyze biomarkers. What made you choose this specific approach?
For me, point of care, which means chair side or immediate results, was really, really important. I think right now, a lot of the testing that's out there on the market that have been out there for many, many years, a lot of the pain points as dentists that dentists were having was the fact that they had to mail it into a lab and wait a couple weeks for the results. With this technology, we're able to provide results in under 15 minutes. And that works, for the patient, especially nowadays when we want results immediately. Patients want to get their treatment plan or get their prevention plan right away and then take action right away. So we've really lifted that aspect of it so there isn't that wait time and people get to take action almost immediately.
Yeah, so where are you focusing most of your energy in the business right now?
We are definitely at a growth phase. Our product is completely developed. We have a lot of dental offices and medical offices that currently utilize our product. We are also moving towards helping consumers and making it more readily available that they can purchase on their own. We are focusing right now a lot on these type of partnerships to make these tests very readily available and even to see if insurance companies or healthcare or employers can even cover this product because we really believe that if you're able to spend just a little on prevention, an ounce of prevention, it makes such a huge difference on the long-term healthcare costs and pain.
Definitely. Maybe you could elaborate a little bit about that. I find that really interesting.
I think that there are a lot of research out there about oral and systemic connections. There a lot of things both start right in the mouth and we see so much of this connection. One of the markers that we measure, it's also in cardiovascular disease. And we've also noticed too, when you go get some sort of surgery or you're going through some sort of medical treatment, they always ask for an oral health screening or a checkoff to be signed off by a dentist that all your treatment is done because even things, for example, if you have osteoporosis and you're going to start some sort of treatment, we want to make sure everything is all completed on the dental side before we go into the medical treatment because then you have less failure rates because of the transfer of bacteria. And so that's kind of like what we try to do is we try to do the screening early on just utilizing saliva and that helps doctors be able to really help predict the success and ensure the success of the treatment. But nobody likes, and I'm a dentist, but I've gotten so many times in the chair that no offense, but I just don't like seeing you because you're associated with pain or high costs. And so really an ounce of prevention goes such a long way. So what we're trying to do is decode your mouth and get these early interventions right now so that you don't go into a situation where you're getting into gum disease, which is then leading to other long-term health issues.
Definitely. So I'm actually seeing my dentist tomorrow. How do I get your product into his office?
Yeah, you should. We work with most of those distributors that are out there, and we're making a huge splash for sure in the dental community. One of the most exciting things that we did, a new code got passed for point of care oral health screening for 2026, and we're so excited to actually have a code that dentists can utilize because it's being recognized as very important in our industry for early interventions. I think that in medicine, we've done a lot of screening through blood. I see our product as kind of that equivalent to bring that help doctors with their diagnosis and early intervention plans.
So, where are you seeing the most growth with amongst your target segments? Is it amongst dentists or who's picking it up?
We are seeing a huge growth actually both on the dental and medical side. I mean, we don't know exactly. We're seeing it kind of split really well, which is really great for us because now we know that physicians were looking for a tool like ours, dentists were looking, and it also brings both healthcare communities together to work together and have a way as an opening for referrals.
It's good to hear both communities are coming together. I know sometimes it can be a wall.
Yes,
So,
yes, yes. I think
even though
get
it's your
along.
mouth.
I don't know who decided to take the mouth out of the body and separate the schools, but I think there's a big push to kind of start bringing both professions back together because everyone's realizing they're so interconnected.
Absolutely. What would you say has been your biggest challenge in bringing this innovative technology to market?
Definitely, I would say our biggest challenge is education. When you bring out a new product like this, and dentistry and medicine have been working the same way for a really long time. People aren't searching for our product. Nobody's going to Amazon and looking for saliva testing or things like that for oral health. So, our biggest challenge has been educating a new category of products. I would say that's honestly the biggest hurdle that we have. But once people know about what we do, I think we often get that feedback like, where was this? And this should be in every single home.
Well, how are you addressing adoption barriers in dental and clinical practices?
We do a lot of different speaking. We will do different types of webinars. We'll have different key opinion leaders talking about things, but it just takes some time to really get that message out there that why this type of test is very important for everyone for their long-term health.
So, what would you say is a common misconception about saliva testing that you frequently encounter?
The common misconception, I mean, COVID definitely really helped in that aspect. Saliva before was just seen as spit and some watery thing that assistants and dentists and hygienists just sucked out with the suctioning. So that's helped a lot. But I would say if there's any misconception is how can you tell with just a pool of saliva, a vial of saliva, like how can you tell this much type of information and is it accurate? And we definitely have proven the accuracy of our product. We're really excited to have that. But the biggest misconception is getting people over the hump that it's not just blood, but saliva can tell you a lot about your health.
And how are you handling the regulatory landscape around diagnostic testing?
I mean, I would say that's always a big challenge. One of the things is if you look at saliva testing in dentistry today, there really isn't any FDA approved oral health saliva test that's out there. We really help in the aspect that we never diagnose, we never say your markers indicate that you definitely have periodontal disease. But what we do is we lean on our providers to take those markers, similar to any lab tests, to actually make the formal diagnosis themselves.
And what's currently the biggest roadblock to wider adoption of saliva testing and preventive care?
I would say the biggest roadblock right now is just moving into people's understanding. Like dentists, is like, how easy is it to, does it disrupt your workflow? And so we do a lot of training with our offices that say it doesn't really disrupt it that much. We really train on how you can efficiently and effectively bring it into your practice and get the tests done and the whole entire um, new patient screening in under 90 minutes, which is typically the benchmark we see in dental offices.
Well, healthcare costs are obviously a major concern. How are you positioning Oral Genome's value proposition to insurers and healthcare systems?
Healthcare costs is a big concern. For us, I saw a list like something about oral diseases being number three, or don't quote me on all of that. But I think that how we position ourselves is we prove out to all our public health partners, all our insurance companies, by paying for our test for their members. We then proved out these are the number of people that we detected early on with the help of providers, these type of diseases, whether it's systemic diseases like diabetes or even oral diseases like periodontal disease. We're able to kind of map out what it costs to care for that patient in the long term and do early intervention versus doing an early intervention or some sort of prevention. So I would say a lot of the insurance companies that have jumped aboard, or any public health type of partner that's jumped aboard, they've been really happy with how we've proven out this value prop, that spending just a little bit on prevention with the oral genome test, you're saving that healthcare system and the insurance a lot. I mean, we have to think about it where people work, they don't like going to the dentist, it takes a long time. And so we help solve those problems by taking this test. And of course, we have to lean on the patient to actually take those actions that we recommend.
What makes it challenging to educate consumers about the connection between oral and systemic health?
There's so much literature that's out there, and I'm grateful for all that literature, but breaking it all down to make it simple, like not everybody is aware of that oral systemic connection. And there are some that are hyper aware because they've experienced it themselves. So there is a little bit of a hurdle with all the information we have out, just not only in healthcare, but what's been going on everywhere, like really honing that message. And it's a big challenge for us, but it's important.
What are your main objectives for Oral Genome in 2025?
For 2025, our main objectives are really just to keep going out there, really um, make people aware of why screening and salivary screening is so important, um, on both on the medical and dental side. And so we're really pushing towards all of that and making this available to everyone.
How are you thinking about expanding beyond dental practices and uh, other healthcare settings?
I mean, there's so much opportunity that's out there. I think there's a lot of expansion that is really with the value-based care, making people healthier again. That's a big push that we're trying to do. That's the main one, along with making this readily available to anyone, regardless of their economic status. Like we really, really see ourselves as that affordable screener for everyone.
Yeah, definitely. Along those lines, what's your strategy for growing the consumer direct market?
I would say definitely education, videos, like again, it's getting that product, why it's important that's out there. People aren't really searching for what we do. And so that's our biggest hurdle that we're trying to work through.
So, how are you currently acquiring new dental practices?
Fortunately, a lot of offices, they hear about our product. There's a big push for salivary testing in our industry and why it's important. We're coming to market at a really good time, and we drive a lot of the providers purchasing our tests just through hearing about us from colleagues or different speaking or conference events.
So, looking at a bigger picture, what trends in preventative healthcare excite you most?
Preventative healthcare, I'm excited the most that patients can just get information and extensive information. And I would say our whole community is very open to that. You see the rise of different healthcare companies that will bring testing to your home or bring testing to a center or to the school. That excites me that we're trying to break the traditional mold, especially with the shortage of healthcare providers that are out there.
And how do you see the role of saliva testing evolving in the next 3 to 5 years?
I truly believe saliva testing will be, and I could be wrong, we could listen to this podcast 10 years later, is really just kind of moving to be towards the standard of care. I feel like it's going to be something that people will know that they need to do yearly in their office. I think we're at a breaking point where we can't just keep looking at disease and being reactive towards them. There's got to be something that we do to help prevent and make sure these things don't happen. Because ultimately, at the end of the day, I think in an ideal world, everybody would love to be cavity free and just go get their teeth cleaned and everything like that. But that's a big ask, and we have a lot of work to get everyone there.
Absolutely. Oh, well, it'll make a huge difference for a lot of people, I'm sure.
Yeah.
So, what will be crucial to get right in the next year?
I think what's crucial in the next year to get right really is just not only just the education, but I also think that patients also need to push for more of these things, push for less drugs, just push for things that they really believe will make a very good holistic difference in their life.
Absolutely. So, if we're to have this conversation again in 12 months, what achievements would make you most proud?
I think what would make me proud is to see this in every office or in every patient's hand because I really believe we're not just helping oral health, we're helping the whole body health too.
I love that. Well, that's it for today's episode of A Healthier, Happier You, the people working to make it happen. A huge thank you to Dr. Tina Shaw for her insights and the amazing work that Oral Genome is doing to help people live healthier, happier lives. If you enjoyed this conversation, make sure to subscribe, leave a review, and share it with someone who could benefit. And if you're a brand or business making an impact in health, wellness, or personal care, we'd love to help you grow. Connect with me at luxhammer.com. Thanks for listening. Until next time, stay healthy, stay happy, and keep making a difference.